Section 6 is about resuscitation. It gives instructions on resuscitating the baby specifically. The first 5 to 10 minutes after birth is the critical time for the baby. Every adult attending the birth should know how to resuscitate a baby. We will use our dolls again, and we're going to role play the resuscitation.
In the Emergency Childbirth book by Gregory White, MD, which was first published in 1968, he talks about a type of CPR which he called bird do. Now, I suppose that that's named after a couple doctors, okay? But he taught this, okay? This is how you do a bird's do. You go like this. You fold the baby like this, okay? Now, if the baby comes out and it's really has a lot of mucus, you can turn it to the side kind of like this and do it. What this does is it actually stimulates the heart and it stimulates the lungs of the baby. It just moves the air in and out, in and out. I'm trained in neonatal resuscitation, and that is basically what we need to do, is to resuscitate a baby. But this method of is absolutely fantastic for stimulating a baby to breathe. I have some CPR, newborn CPR papers that I want you to look at. It's in the mini guide when you download it, okay? When you learn CPR and so forth, it talks about stimulating a baby. And they talk about rubbing it. See, we rub the baby with the towel, the back, when it's first born. It talks about flipping the feet or whatever. But this bird do is the best and fastest thing that you can do to stimulate a baby. So let's say this baby comes out and the baby looks normal color, okay? It might be even a little purple, but it seems active. You put the baby right on the mother, okay? And the towel and the mother stimulates the baby, should be fine. But let's say the baby comes out and the baby is limp, okay? So before I put the baby on the mother's stomach, I am going to stimulate this baby. And I am going to do 2 or 3 at the most, that's all. If this baby is not crying, okay, by the time I get through, then I know that I'm going to have to work on this baby. So I don't miss any time flipping its feet and rubbing its back or whatever. I put this baby on the mom, okay, and then I'm going to start CPR, okay, blowing into the baby's mouth and whatever. I use a bag and mask, but you know, it's the same thing if you do it with your mouth, okay? So I want you to take your dolls and I want you to pass it, and I want each one in your row to do 2, 3 of these and put this on the mother and do it. Now, when I had an experience once when I left a birth because the lady had pretty much stopped her labor, and she was a little ways away, and we had stopped at a Kmart or something, not too far up the road, and then I got a call, come quick, I'm back in labor. So we went, she was in Mona, we went down the road, okay, and came off. As we came off the highway, I said to Coral, who was driving, I said, Coral, I feel like the baby has been born. So she was only a couple blocks away, so we went over there and stopped, and the kids ran out of the house saying, the baby is born, the head is born, but the baby is stuck, okay? So what is shoulder dystocia? It was a 10-pound baby, okay? And she had her sister there, was there with her, who was a nurse, okay? But the sister was not aggressive enough. That's what I mean. You got to get a baby out. So went in, ran into the bedroom, turned her over, got the baby out, and the baby was limp, okay? Here, this huge baby was limp. And I went like this 3 times, and the baby started crying, and the baby was just fine, okay? So it's a wonderful tool to use to stimulate a baby, okay? You're not going to press the baby hard enough that you're going to rupture its liver or something like that. In other words, be gentle, but it works, okay? And you can put the head down if you want to. Put it around like that. Now, let's say that the baby has been born and the baby cried and was fine and came up on the mom, okay? And then all of a sudden, the baby starts to go limp, okay? What you do is you take the baby and you do this 2 or 3 times is all. And if the baby starts to cry, which it probably will, okay, because it just is kind of been in shock and whatever coming out, then if it's crying, you know it's breathing, okay? Crying is a good thing, okay? So you could even pinch it a little bit. I'm just teasing. Well, anyway, you got this baby crying and it's fine. And then put it next to mom, and a few minutes later, it starts to go limp again, okay? Do the same thing. As long as it keeps responding, you're okay. Now, the same thing, you can use this. Let's say you actually do some blowing, some CPR on the baby, okay? And the baby starts to cry and the baby is fine, okay? Up on the mother, the baby goes limp again, okay? No crying, then you go to CPR, okay? Very important, this sequence of going through back and forth. This bird do is absolutely a wonderful thing to do, to know. In other words, it'll save you so much time. And let me just talk to you a little bit about resuscitation. The British and European methods of infant resuscitation are actually better than the CPR and neonatal resuscitation that's taught in the United States. And there is one big difference, and that is, if you look at your little newborn CPR thing that I passed out to you, the reason is this, is that in Europe and England, the first time that you give breaths to the baby, they're called inflation breaths, and they're longer than regular CPR. The reason is this. When a baby is born, the lungs of the baby are full of liquid, okay? There has been liquid in the alveoli and in the lungs in order to expand them and get them ready for oxygen, but they have water in them, okay? So, what has to happen is that that water needs to be pushed out into the lymph system and the air fill in where the water used to be. That is the whole principle of resuscitating a newborn. Extremely important. Where if an adult passes out and stops breathing down here, it's probably a heart attack, okay? That's why they do just heart work, the compressions, okay, on an adult. That's what you're supposed to do. But a newborn is completely different, okay? It is filling the lungs with air. And it may take, 2 or 3 or 4 times to get the lungs so that they're full. And you have to be careful, because if you put too much air in them, you can have a pneumothorax. You can put a hole in the lungs, and then the baby is really suffering. But be gentle, etc. So what you would do for the 5 first breaths that you're going to give to the baby, okay, is you are going to give them so that they are longer. So it's 1, 1,000, 2, 1,000, 3, release. So you are putting your mouth down that whole time. Then you have to get off of the mouth so that the air can come out. Then you do that again. So I want you to just kind of play like you've got a baby in your arms right here. You're down, mother's got holding the baby in her lap, and you are there. And I'm going to count for you. 1, 1,000, 2, 1,000, 3, release. Okay. 1, 1,000, 2, 1,000, 3, release. 1, 1,000, 2, 1,000, 3, release. 1, 1,000, 2, 1,000, 3, release. Okay, it's a baby. You need to keep ventilating a baby, okay? You do it on a shorter cycle now, because you should have filled the lungs by this time. And you could feel that, okay, because when you blow in, if you put your hand on the chest, you can feel it expand. It may take 3 of those longer breaths before you start to feel it. But by the time you get through with the 5 inflation breaths, you should be able to feel a rise. If you can't, adjust the head and go for it again. But then you go to ventilation breaths. And I want you to practice that. It's like breathe 2, 3. So the breath just goes in, breath 2, 3. You go off, breath 2, 3. So practice. Breathe 2, 3. Breathe 2, 3. Breathe 2, 3. Breathe 2, 3. That is a waltz, okay? Remember a waltz, coming in and out. Then, if you have to do chest compressions, you can do it on a baby like this, okay, with your 2 thumbs. It's probably one of the best, right between the armpits, okay? Or you can do it with 2 fingers, okay? There's 2 techniques, but I like the two thumbs, but then someone else is breathing if you've got a double movement. And that is how that works. So you do 3 compressions to 1 breath. 1, 2, 3, breath. 1, 2, 3, breath. That is basically how you do it with the baby. Now, I have actually never done chest compressions on a baby. As long as I am listening and I can hear the breath go in and the heartbeat is high enough. You don't start compressions unless your heartbeat goes under 60, okay? So if you can do that, you can keep a baby alive. I think the longest I have ever worked on a baby was maybe 15, 20 minutes. I bagged the baby. I kept bagging the baby, but I had a stethoscope in my ear on the heart, and the heart rate was fine, okay? And I never transport the baby. The baby was fine. It was a bad breech delivery, okay? And so I just kept working on the baby as long as that heartbeat is fine. Your you're doing good, the baby's getting oxygenated, the baby's not really going to have any damage. So, in other words,
so did that baby stay nice and pink for you, or was the baby a little dusky in color while you were working on it?
well, it was a little dusky to begin with, but as I was working on, the color came up and was fine, okay? And I could hear it. Now, this type of thing, this little sheet of paper, you need to take with you to if you get called out to a birth or if you're helping someone. So that let's say if you're there, okay, and someone else is doing the resuscitation, you can count for them. You look down here and say, oh, yeah, this is what we're supposed to do, because sometimes you forget in a scary situation as to what to do. And so you count 1, 1,000, 2, 1,000, 3, release. So you help that other person who is doing CPR and you talk to them and explain it to them. I have to tell you this funny story. The first person that I ever heard that had an out-of-hospital birth on purpose, okay, was a friend of mine's wife who I had known in college. And they came to visit one day, and she was from England. And she never, she didn't like the way that American obstetricians worked, and she was not going to go into the hospital. So she read and studied and everything else, and decided she was going to have her baby at home and have her husband deliver it. Now, her husband didn't know a thing, okay? She was the one that knew everything, okay, and had studied so hard. And so when it came time to do the baby, he just stepped up and she told him what to do. And he did what she said, and they had success. I thought that was the strangest thing that I ever heard of. Why would anyone do anything like that? But as I say, the babies were fine. So anyway, so you can help someone else who is working on a baby by getting your paper out and saying, now do this a little bit longer. I'm going to count for you. You work with me, okay? And that's kind of the way it is.
Okay. So how long would you wait before you would call 911? I mean, if you have a baby without a heart rate and not breathing and you're resuscitating, how long do you work at that resuscitation before you would dial 911?
Oh, well, if I didn't have a heart beat, I'd call him immediately, okay? In other words, on this one I worked on so long, I had a good heart rate on the baby, okay? Okay, now, one thing that I think is absolutely fabulous is to really remember who you're working with. And these little babies are not just blank sheets when they come. They can't communicate very well because they don't speak English or Finnish or Estonian or, do you know what I mean, Spanish, wherever they happen to end up. But they are so intelligent. They are so smart. And they will help you if you need to resuscitate them. I remember working on a baby who had a real short cord when it was born, you know, really something else. And it had really stressed the baby out, and it had a lot of fluid in it. And so I would suction the baby, and then I'd talk to the baby. Now cough it up, cough it up. And every time I would talk to the baby and tell the baby to cough, the baby would cough for me, okay? They will help you. They will be there. There's an old-time book that I think was pretty good, Babies Remember Birth, David Chamberlain, PhD, and he has many experiences in here of how children, especially at the age that they learn to talk at 2 or 3, they start and tell about the birth experience that they had, and report things that actually happened at birth, but no one had ever told them about. San Diego man told me a story about his daughter. When she was 2 years old, he asked her if she remembered what it was like before she was born. She replied it was like this, and assumed the exact position he remembered from an x-ray taken just before the birth. The x-ray, prompted by peculiar labor and fetal distress, revealed a frank, breech position, a kind of jackknife position with the baby's bottom in the pelvis instead of her head. Children have their own words, broom, broom, whatever. They speak of being born in the water or a pond, or swimming, and coming out through a tunnel to bright lights and cold. In an obvious reference to the umbilical cord, one girl said, "There was a snake in there with me. It was trying to eat me, but it wasn't a poisonous snake," okay? Cesarean children come through a different doorway. One boy said he came out by himself when there was a big cut made by the doctor. He also described the circular motion round and round and round used to apply antiseptic before the incision, okay, on the womb. I mean, it's really fascinating. You'll see babies in this book small children said how they were really upset at their birth because they were taken away from their mother immediately, and saying, "Well, the doctor said I had to be suctioned, but I didn't. I knew better, okay? I wanted to be with my mommy." And that is, in an emergency situation, okay, it is that baby going into the arms of the mom and having that bonding take place that will heal the mother from any trauma that she happened to have because of it being scary, because it was coming too fast, or in a situation where she couldn't go to the hospital. So it is the parents who communicate with them. And if you are resuscitating a baby, okay, you are going to keep that umbilical cord attached to the baby if at all possible, because the baby is still getting oxygen from it, and so you're going to be doing it right on the mother. Now, what do they do in the hospital? They clamp and cut the cord and take the baby off to a heating unit, okay? That mother and that father can do more for resuscitating the baby than any machine. That father putting his hands on the baby, that mother putting her hands on the baby, telling the baby to breathe, telling the baby what to do. "We love you. We're so glad you're here." Because babies, when they come out, okay, are often kind of shocky for a minute or two. In other words, that's quite a transition for them, okay? And when they have their parents there, bringing that baby in and telling them that they love them and want them to be there, that is just so important. And that is one place where you, as an attendant at a birth, need to step back and let the parents, well, not if you're resuscitating while they're doing, but let the parents do that bonding and with the baby instead of infringing in their space. Very important. Any more questions on this delivering the babies? You guys are going to do great. Yes.
With my last baby, the placenta came out in pieces. What do you do with that?
We're going to be talking about that in the next section. Okay. Bleeding, okay, because that is really important. Okay. Uh-huh.
I know this emergency of childbirth and all the what ifs. What if is your only choice is C-section or mom's death? I mean, how far is our training going to be?
So what?
You would never do that. Would the mom die? I mean, if you couldn't get the baby out, or you're at the point of having to do a C-section?
We'll talk a little bit about that, but I've always said that I would never do it in an emergency situation unless an angel came down and I saw it and drew a line where I was supposed to do it. Yeah. I think basically in an emergency situation, there would be a way to triage certain women, and they would take a certain percentage of women into the hospital, I think, but you never know. Okay.
So have you ever had that situation, Diane? Have you ever had to transport a mother to the hospital to complete the delivery, or have you been able to deliver?
Yeah, my transport rate is very low, probably about 2 to 3%, and most of those are high-risk women. So, yeah, I had to. But that doesn't mean that they couldn't give birth in a disaster. In other words, it was just better in this situation to go.